Keith and Evelyn are 14 months apart. They're 5 and 4, starting school, having a lot of fun. They're wild, crazy, and normal, everyday kids. Keith was about 8 weeks old when he was diagnosed. We had gone in for a checkup and he was diagnosed with craniosynostosis, which scared me to death because I had no clue or had never heard of anything like that.
We were very upset when Keith was first diagnosed. We didn't know what the future would hold for him, whether or not he was going to have a normal childhood, what the treatment options would be. But after we met with a couple of different specialists and found out what our options were, it was very reassuring. We were pretty confident that the odds were so low that having another child that Evelyn wouldn't have the same condition. And when we found out that she did, we were very surprised.
Keith and Evelyn were both born with the same unusual condition, which is sagittal craniosynostosis, a condition that children are born with where they have an unusual head shape that can restrict brain growth.
We went in to meet Dr. Rhodes and Dr. Ty, and they were very warming and very helpful. They even sat down with the kids and held them when we were talking with each child and reassured us that they would do the best that they could do, and were very upbeat and helpful.
We had done our homework on the internet, and then we were going around interviewing doctors, trying to see who would, fit what we thought would be, our qualifications, and by far, Dr. Rhodes and Dr. Ty were the best.
The treatment for craniosynostosis is a surgical reconstruction of the skull. The skull is reshaped to be the shape that it would have been if the synostosis had not happened.
After the surgery, Keith and Evelyn returned back to normal and happy as they could be, normal babies, no different than our older two were, and love to play sports, love to get into stuff, and always keep me on my toes.
Keith and Evelyn have an excellent prognosis. I would expect their intelligence, their school achievement, and their development to be within the normal range. It's an enormous privilege to be given the responsibility of caring for someone's precious child. Our craniofacial team really strives to treat every child as if they were a member of our own family.
The nurses there were remarkable, even to the point that after surgery, holding our hands when, the kids cried and we didn't understand why, and they just really touched me. To this day, I stay in touch with them.
Being a pediatric plastic surgeon is in many respects like having a magic wand. We're able to transform the faces of children and really make a dramatic difference in the lives of those children and their families.